One of the most interesting parts of the human body as a doctor is making sense of symptoms. A rash in your groin could just be a rash in your groin, but it actually could be leukemia. A change to your nails could just be a local nail abnormality, but it could also be something else, a disease in a distant part of your body or a clue to your overall health. Here are 9 nail changes that could mean serious disease. If a fingernail or toenail has a new or changing dark streak, you need to get it checked out. That dark streak could be a type of malignant melanoma, which is the most dangerous type of skin cancer. Acral means that it happens on the palms or soles and can be quite difficult to spot. And lentiginous means that it's much darker than the surrounding skin and it often looks like a stain or bruise. Not every dark streak is a melanoma, but it's always important to get them checked out, especially if it's new or changing, and the earlier the better too. This is when a nail lifts up, so it's not attached to the nail bed anymore. It often lasts months, and once a nail is detached, it won't reattach to the nail bed. A new nail should grow to replace the old one, and this can take about 6 months for fingers and 9 months for toenails. This usually happens because of a fungal infection, psoriasis, or an injury, like from an aggressive manicure or cleaning nails with a sharp object. This is an infection of the skin around your nails and classically has redness, tenderness and throbbing around your nail. It can sometimes cause changes in the shape of the nail and it can cause it to detach too. It can come on quickly and last a few days, which is an acute form, or it can come on slowly and last weeks, which is chronic. Acute infection is common around the fingernail and it's usually due to damage to the skin from biting or picking or manicures or other physical trauma. Chronic infection happens around the fingers and toes too and is usually associated with a fungal infection, but can often have more than one type of infection, like a fungus and a bacteria. It's commoner if you work in water a lot. Wet skin and excessive soaking can disrupt the natural barrier of the cuticle, which causes bugs to thrive. Both the acute and the chronic form can be treated with either warm soaks, antibiotics or antifungal agents. If you have dents in your nails that look like they were made by an ice pick, this could be a sign that you have psoriasis. This is by far the most common cause of this sign. But it can also be found in things like eczema or atopic dermatitis, alopecia, and some other rare conditions too. While it's easy to spot, it's quite difficult to treat or manage. Treatment options do depend on the cause, and it can include things like steroid injections to the nail bed. Sometimes supplements can be helpful, or even strong immunosuppressant medications. This is actually a rare condition that causes, yellow nails and swelling. The swelling is often caused by something called lymph. This is a colourless fluid that circulates through our body. It's caused by problems with lymph drainage, such as a disease called lymphedema. FYI, yellow nails can also be caused by a fungal infection. This is actually probably one of the really common problems that affects nails, but also causes slight yellowing of the nails. If you have this, it's worth speaking to your pharmacist for treatment options. Lines that run the length of a nail are common and usually nothing to worry about. But if you see deep grooves that run the width of your nail, like the ones shown in this picture, it means that something slowed or stopped your nails from growing for a while. It can happen on one or multiple nails, and it usually happens due to picking at the ends of the nails or the cuticle, or getting an infection like I mentioned above, especially around the nail, and after trauma like a manicure. But disease can also cause it too, in rarer circumstances like kidney disease, thyroid disease, or even chemotherapy. This happens when the nails thicken and overgrow due to one side of the nail growing faster than the other. They're called ram's horn nails for an obvious reason, because they're thick and curvy and actually quite difficult to miss. It's the toenails that are usually affected, and they tend to look really distinctive. It's usually caused by trauma, such as wearing incorrect shoes, which can damage how the nails grow, or infection, like a fungal infection, which can cause thickening and affect nail growth. There are some other causes too, like psoriasis and even poor blood supply to the feet. We can treat these by cutting them or surgically removing the nail, depending on the cause. And a podiatrist, a healthcare professional specializing in feet, is going to be really helpful here. These are nails that are thin, soft, and shaped like a little spoon. There are lots of causes, but by far the commonest one is iron deficiency. If you have it, do get checked out, as you'll need a blood test to confirm the cause. The tests tend to include a screen for things like gluten, thyroid disease, diabetes, and iron, to make sure that we know exactly the right cause. This is when the nails start to curve downward, the nail beds get much softer, and the nails become much more round. Sometimes the tips of the fingers or the toes seem to bulge out too. This tends to come on over weeks, but it can be slower, and it's usually a sign of a serious problem, such as lung diseases, especially cystic fibrosis, pulmonary fibrosis, or bronchiectasis. Heart defects, cancers, inflammatory bowel disease, and liver disease, amongst other causes, can cause it too. We don't know exactly why it occurs, but we do know if you see it, you need to get checked out. And that's it, 9 nail changes that could mean serious disease. As always, if you're unsure about what's going on in your nails, or anywhere for that matter, get in touch with your healthcare professional. Till next time, stay healthy.